big failure of judiciary, of the nation, of so many people who cheated me on cylinders, who didn't give me facilities on time. And my father couldn't get anything on time. Everything got delayed, everything.
India's COVID-19 double mutant B1617 apocalypse continues, with the actual numbers of deaths and infections many times the official number of 400,000 infected and around 3,500 deaths per day. As we witness the collapse of India's healthcare system, could see the number of total deaths exceed 2 million before the end of May. Meanwhile, Indian politicians live in an alternative universe, making announcements such as that all Indians over the age of 18 can now go and get vaccinated, despite the fact that most of the vaccination centres have closed due to lack of vaccines, which means only 10% of Indians have had one dose and just 1.5% have had 2 doses. If those in charge of India had any sense of intelligence, then they would be focused on vaccinating the most vulnerable, i.e. the over 45s, and not opening up vaccinations to all adults. Instead of which, India's government's primarily focused on peddling misinformation in trying to hide the magnitude of the catastrophe underway, which includes instructing Twitter to delete tweets critical of the management of the pandemic. Whilst mainstream news media is focused on what is taking place in India, however, neighbouring states such as Pakistan and Bangladesh, with even weaker healthcare systems, are in for a catastrophic May as the Indian strain becomes dominant. Again, the actual number of cases and deaths will be grossly underreported in both nations, with that has even a lower rate of vaccinations than India. The current state of the pandemic has the UK trundling along at a low level of 32 cases per million, with the US stagnating at 150 cases per million, whilst Europe remains high due to incompetence in the rollout of the vaccination programs, and thankfully all appear to be turning the tide and heading lower, though all are awaiting the consequences of the new emerging strain out of India that is so far more infectious than that which has displaced the UK strain to become dominant due to having double the mutations of the other strains. Still, so far the UK and US is steady as you go, with the US moving ahead of the UK in terms of taking steps to come out of lockdowns. Even though the death rate looks a little higher than it should be, with about 40% of adults remaining to be vaccinated in the US, whilst the UK is adopting a more cautious approach to coming out of lockdown, with the next major relaxation in rules to come on the 17th of May, thus allowing more time for vaccinations to take effect. COVID-19 in Italy since August 2019. Well, an open source peer-reviewed study in Italy states that antibodies for COVID-19 were detected in blood samples taken in Italy as early September 2019. The blood samples were taken from 959 asymptomatic patients as part of a nationwide lung cancer screening program that subsequently tests showed contained 111 or 11.6% had antibodies to the SARS-CoV-2 in the receptor binding domain, which means they were definitely infected with COVID-19 over 4 months before Italy's first official case of COVID-19, which was via 2 Chinese tourists on the 30th of January 2020, who had travelled from China to Rome, whilst the first Italian confirmed case of community spread of COVID-19 was on the 20th of Feb 2020 in Lombardy. So out of 111 positive antibody results, 23 23 were in samples from September 2019, 27 in October 2019, 26 in November 2019, 11 in December 2019, 3 in January 2020, and 21 in February 2020, just before the pandemic took off. The earliest exact sample for positive results of antibodies was on the 3rd of September 2019, which means they would have been exposed to the virus at least during late August 2019 and probably earlier. And this map shows where the blood samples were taken and the number of COVID-19 antibodies detected. What this implies is that Chinese travelers and migrant workers had been spreading the virus long before the story first started to break during January 2020, and thus it is highly likely the virus was endemic in China mid-2019 that the Chinese authorities had suppressed knowledge of right up until mid-January 2020, when the exponentially expanding epidemic could no longer be covered up by the CCP. This illustrates why one cannot invest or deal with China, because one just cannot trust any of the facts and figures that spew out of this Orwellian totalitarian state, given the state's criminal suppression of the facts concerning COVID-19 that predates the official announcements by a good 6 months. Finally, vaccinations. Remember all that noise the EU was making about the risk of blood clots from AstraZeneca, where the risk resolves to about 1 in 500,000 chance of such an adverse reaction. But apparently the Pfizer vaccine is also seeing serious adverse side effects, as data out of Israel shows out of 5 million vaccinations given, there were reported 62 cases of myocarditis, resulting in 2 deaths. Those at highest risk are men under 30 taking their second shot, i.e. 1 in 10,000 risk. So expect such numbers from nations heavily reliant on Pfizer jabs, such as the US and Europe, as they extend their vaccinations to the under 30s. The irony is that the risk of heart issues from Pfizer jabs is about 5 times higher than that of blood clots from AstraZeneca. This implies under 30 should choose their vaccines carefully. Young women should opt for Pfizer and young men opt for AstraZeneca or Johnson & Johnson. This just throws more egg on the EU's face, who are busy putting up a smokescreen by suing AstraZeneca to hide their own criminal negligence in the handling of the pandemic. Anyway, this just goes to confirm the UK leaving the EU was the right thing to do. And this video was an excerpt from my latest timely analysis on when to buy AI tech stocks such as Google, as we look set to enter my forecast window for a stock market correction, covering topics such as why I don't even think about selling good stocks such as Google, opportunities in price volatility, what happens when one sells out of a good stock, the risk of loss, and how long to invest for, as well as to understand the AI and inflation megatrends, and when to finally consider to bite the bullet, and more, all of which has first been made available to patrons who support my work. So do consider becoming a patron by supporting my work for just $3 per month for immediate and full access to all of my analysis and trend forecasts, including my schedule of analysis that covers more high-risk tech stocks for the long run, and Bitcoin trend forecast, and importantly, updated AI stock buying levels and valuations, amongst many more analysis. So again, do consider becoming a patron by supporting my work for just $3 per month. In fact, my recent video showed how one with a decent GPU could easily cover my Patreon fees of $3 plus for several years by just crypto mining in the background with one's desktop PC for say a couple of weeks or 4 weeks, whatever, with the likes of NiceHash Quick Miner. I do it, effectively get free money from the crypto mania bubble for just having NiceHash Quick Miner running in the background, mining on the GPU at a relatively low rate. So do check out the video for full info of what it's like to crypto mine with NiceHash in the background on your desktop PC. And do remember to subscribe to this YouTube channel for new videos as we protect ourselves from the central banksters' rampant money printing exponential inflation by riding the also exponential AI megatrend into the future.